So once again, you are welcome, and we are really very excited having all of you on board and having you make our time to be here. We are going straight into, the pandemic fund treaty negotiations and processes. And we just want you to, be able to paint a picture of why this is really very crucial and why you are supposed to be part and parcel or the center of this actually. So I would love to yield the floor to the global coordinator who is going to be taking us through, the start of the presentation, and then I could take on from somewhere too. Thanks.
Great, thank you, Brenda. And again, happy to have you all here. And as you might see in the screen, we have denominated this session Gender Equality and Human Rights Now, and that's specifically what we are talking about now. I'm wondering if many of you or some of you have heard about like the pandemic treaty process. And if you have not, then this is the perfect moment for us to talk about it, to know what is going on in this global scene. And that's why specifically we are sharing this important information with you. And we know that gender equality is crucial for every response that we try to manage as the world. And just like in this sense, I'm going to start talking about what is the main reason why we are all here and what we can do so we can engage more. So we're talking about a bit more in the introduction, insights, then we have a call to action that we are going also to present, and then we want to build it with you. And then we have some questions and answers from the audience. Just like to start and let you know why it's important for us and for us women in all our diversity, independently of our age, of origins, ethnical background or cultural background, why it's important for us to be engaged in public health. And it's really, really key to know and understand that women, we have been in the first and also in the last lines of defense of public health during emergencies, during, for example, the COVID pandemic, where we were in front of the response. And there were so many challenges also that women face in this specific pandemic. And same applies for HIV, tuberculosis, and malaria. And we know by evidence that community protection, public health, and health security systems are highly dependent on our work as women in the diversity for health services, for community services, as the key base of society for inclusion, protection, and taking care of families all around the world. We know that we play a crucial role in community and national participatory project design, implementation, monitoring. We can produce and work on integration of large data sets. And we also have produced and work on evaluation processes. We know that women-led organizations, communities, and women from civil society from different regions, especially from the global south, are experts, and we have an incredible knowledge about how to really advance human rights and everyone's security and guarantee the human rights for having community-led services delivery, that this can be really applied to public health services and assure a high quality about what we deserve as women in health. Next, please, Brenda. And if you have not heard about the pandemic treaty and pandemic prevention yet, we want to have this webinar because we are concerned about the fact that some of the diseases that happen or the COVID-19 pandemic had set back the fight against so many other diseases. And this, of course, includes HIV, TB, and malaria. So, and that's why we are here. We need to advocate to understand what are the structural barriers that are not currently addressed, and why the world has decided to keep on working on a pandemic treaty negotiation. And we need to learn from the lessons learned from the HIV, TB, and malaria response, so we can really go and work towards the accomplishment of the SDGs. That SDGs are the Sustainable Development Goals that probably you have heard. And these are important commitments that the world and the governments have agreed to achieve. But we are in a process and still that we need to put more efforts to really conclude, to really go on this together. Can you go? This is okay. This is the next slide. And why we are here and why you were invited to join this webinar. It's really important for us to have your support, to have to also share the knowledge with you, and also to know that we as a movement of advocates from different countries and regions, we are all included in this process of negotiation, understanding, implementation, and of course, meaningful participation of women in advocacy. And we are committed to see this meaningful participation of women and girls, of our networks, of our colleagues, of our national focal points and Flourish group that I celebrate. You are all here together to ensure that we are actively involved in this pandemic treaty process, and that we can really uphold gender equality and human rights inclusion in the next process. We are sure that we can strengthen key community-led organizations, and we can advocate for this meaningful participation and engagement in the pandemic treaty processes at the national levels and also in the global scene. And we want also you to know what is going on, so we can ensure that you can be included and participate in this significant process. So these are the main objectives, and that's the reason why we are here, and then why we're going to talk about the pandemic treaty. Just be sure that the objective of Women for Global Fund is to spread the word about our needs as women in the diversity, and that's why we are also going to talk about later on about the call to action. I will stop now here for, just to give Brenda the floor. So she's going to just give a brief overview of what does it mean, and the pandemic treaty, how does it arrive to this global scene? And once again, feel free to just ask questions and comments in the chat, and then we can address those things afterwards. Thank you, Brenda.
Thank you so much, Angela. Thank you. So I'm going to be continuing. Basically, what is the WHO Pandemic Preparedness and Response Treaty? I think one of the core things to note is that, in as much as it's not every year, but we wake up to an outbreak of disease. And that is where we talk about, like the global health crisis, and why there is a need for mobilization of different stakeholders, governments, development actors in response to disease outbreaks. And so there was a newly established body named the INB, which is the Intergovernmental Negotiation Body, which was created in March 2021, which happened to be a group of leaders that announced the initiative on this new treaty on pandemic preparedness and response. And the whole idea, or the whole, emphasis was for the need for stronger data sharing, surveillance, analysis, as well as the development and distribution of vaccines, therapeutics, and diagnostics as global public goods. When we talk about global public goods, basically, I want to paint a picture for you. Public goods, we all have maybe heard of this in school, especially at secondary level of education. And public goods will actually refer to goods that have been provided by governments at a subsidized cost or free of charge. So when we talk of global public goods, in this particular sense, that is what we mean. And so, aside this core focus or this core objective of the WHO Pandemic Preparedness and Response Treaty, there was a whole lot of importance stressed on healthcare infrastructure, capacity building, research, and development. Moving further, basically, I want us to be able to also understand conventions, agreements, and their need in global health and why they're crucial. The global community functions under different, treaties, or basically agreements that are binding, to the states or the member states that are part of it. And all of these provisions of the treaties must, uphold human rights in all ramifications. And so when we look at in international instruments, we talk about these agreements that are signed between nations, such as conventions, they could be framework agreements, they could be treaties. And so in 2005, the International Health Regulations had, these key international instruments on international health, with roots in the World Health Organization Constitution. And so we had 194 member states of the World Health Organization that created this mechanism to design and negotiate a new international instrument on pandemic preparedness and response to prevent. So the reason why this is really very crucial and really very important is the need to prevent and respond to upcoming pandemics. And we get to realize that we wake up every day to disease outbreaks. 2020 still hits very fresh when the world woke up to a new normal at the onset of the surge of the COVID-19 pandemic, and life has really never gotten back to what it used to be, although the World Health Organization declared that it was no longer a global health emergency. And so you get to realize that the World Health Organization, international instrument on pandemic preparedness and response is really very crucial to be able to tend to upcoming pandemics as the likes of COVID-19 and several others. Moving forward, we get to understand basically what is the Accord development timeline? What does the timeline really look like, right? What can we see about this particular Accord? And basically, signatory countries, what is the impact over signatory countries? When we talk about signatory countries, it's very important to understand that signatory countries are basically, members of that particular treaty. For example, when we talk about the World Health Organization and the Constitution, we talk about 194 member states that are part of that particular, constitution, basically. So these are the signatories that we make mention of. And so the INB, I'm very good at using, I'm very, very good at using initials. So please kindly, spare me with that. So sorry, I have to go back. So the INB, I'm trying to get something off my screen. I'm so sorry. So the International Government Negotiating Body, it convened in person between February and June 2022. And so this convening was to agree on ways on which we could work to engage stakeholders in an inclusive manner. And so there was the conceptual zero draft, which is the CZD of the Accord that was discussed in December 2022 and shared with member states on the 1st of February 2023. So now you're able to connect the dots, right? You're able to paint a picture of the timeline. So the convene in February and June, and the co-design of the first draft and shared with the member states in December 2022, and then shared with the member states February 2023. Now you get to see the timeline. And so the zero draft is going to be considered by WHO members and stakeholders at the INB 4 and INB 5 in 2023, this year. And it's going to be submitted to 77 World Health Assembly, to the 77th World Health Assembly, that's the WHA, in 2024. So you get to see a perfect mapping of the timeline of the Accord. So it's a process. It's not just something that happens at a go. And so the zero draft of the INB Bureau outlines potential guiding principles and rights for a new Accord. So it's going to be determined by member states. Again, we go back to the impact over signatory countries. And so this Accord is only binding, to the signatories based on whether they decide if it is, after looking at the provisions of that Accord, right? So it is expected to help prevent, these are the provisions, to prevent future disease outbreaks from impinging on people's freedom to travel, to work, to seek education, and lead a healthy life. So member states decide on whether the provisions of the Accord is legally binding or not. But when we go back to treaties and agreements, we get to realize that every state that is part of this treaty is expected to implement that treaty in good faith. So that's one of the core things to actually note. So now this is the core of today's convene. what is the relationship between the World Health Organization Pandemic Treaty and HIV, TB, and malaria pandemics. And it takes us to why Women for Global Fund is basically, radical about this. Now, we live in an era which really has been a repetitive cycle back in time. If we retrospect back into history, basically, we get to realize that a lot of treaties are being signed, a lot of agreements and accords are being signed, but the gender transient is left out of the equation time and time again. And so there is always a very great mobilization to address disease outbreaks, and there are always these response mechanisms put in place, but people are left out of the equation. And so the Pandemic Fund Treaty, you get to see that it sets out to strengthen global health governance against future outbreaks through a binding treaty on pandemics. And then we have Women for Global Fund stressing on the importance of including women and girls in all their diversity in decision-making and implementation processes. You would agree with me that a lot of, for example, national health mechanisms, national health policies and action plans are pitch perfect, but at the end of the day, you really cannot account for the implementation stage of this particular policies and response mechanisms, because women who happen to be the vulnerable populace are left out in one way or the other. But now it's not just the women, right? It's not just the men, it's not just the youths, it's not just the children. In all of these different divisions that we have subdivisions as well. And the subdivisions are left out in one way or the other because the diversity is not accounted for. And this is where Women for Global Fund comes into the picture. So ending inequalities by reaching those who have been left behind and addressing the root causes of vulnerability as key elements for the current and future pandemic responses. So it is very glaring as the case of HIV, TB, and malaria has been. So now Women for Global Fund advocates for gender equality and women's empowerment, thereby sharing concerns, expectations, and demands about the conceptual zero draft of the proposed World Health Organization Convention. And this is why we have you on board as well, from your different networks, not just the national focal points, not just the Flourish groups, but those of you who are representing different organizations. We cannot thank you enough for coming here, because like I often used to say, alone I can work, but together we can run. So together we can make a very loud and solid voice that is loud enough to be heard, and we can together work in synergy to build key partner messages, to send out this call to action to stakeholders, and actually just put out key messages on our different social media handles and be loud on this particular quest for equality and inclusivity in the pandemic treaty negotiations. And without wasting any time further, I would love to leave it here for Aliyah. Aliyah is going to be taking us through the call to action, and then we would later on get to questions, we later on get to concerns and comments. And what is going to happen is, this is the roadmap aspects. I will stop sharing my screen. She will take us through what a keynote message to stakeholders will be. And then together we would agree on the campaign strategies, agreements, and commitments. And then we will be open to, questions from all of you and taking note of every proposal and recommendations that we give. Thank you once more for your time, and Aliyah, the floor is yours. Thank you.
Thank you, Brenda. Thank you for this great presentation. I join you in saying that we thank you very much for your presence today. And I think that with all of you, we can make the difference. So I'm here today to present to you a draft of call to action that Women for Global Fund has prepared. So the purpose of this call to action on the pandemic treaty is actually to advocate for the inclusion of gender transformative actions, to have transparency and an active engagement of women's organizations, civil society organizations, and community networks. So I think that this call of actions aims to emphasize the importance of integrating all these principles into the treaty development stage, implementation, but also monitoring processes. So we would like, as Women for Global Fund, to actually raise awareness among all our stakeholders, partners, national focal points, flourish groups, about the significance of addressing actually gender inequalities, promoting transparency, and ensuring the participation of all in the pandemic response. So I mean, as Women for Global Fund, we would like also to amplify women's voice. With all of you, we can ensure that I mean, your experiences, your needs, and recommendations are heard, and that they are also considered in the development and implementation of the pandemic treaty. We would like also, from this call to action, to have a widespread support and engagement from women's advocates, activists, and organizations, and who are really passionate about making gender equality in pandemic response a reality. So I will present to you the draft of call to action, and then maybe during the session of question and answer, we can discuss all the details. So just let me share my screen. Okay. Can you see my screen? Okay, great. So this draft, so we started by presenting the general context of the pandemic treaty. So we have all, of course, to talk about COVID-19 and its impact on low and middle income countries, and especially women and young girls in all their diversity. So as Women for Global Fund, we call, for and recognize the importance of including women's organizations and young girls in all the decision making and implementation processes. Then in the introduction, we are talking about how the pandemic management is being done. So we had during COVID main structural barriers that were based on harmful gender norms, and that really increased the vulnerability of women and girls. So we are calling to stop these norms, because they are depriving us of our voices and the ability to make decisions regarding our own health and lives. And so this is important to present, because when we are working on these barriers, like access to education, reducing misconceptions, the language, access to technology, we are able to encourage the participation of young women and girls in the process. So we are also talking about how we can end these inequalities by reaching those who have been left behind, like we saw in COVID-19. And we have to address the roots of vulnerability and exclusion in the future pandemic responses. So we have to recognize, as Women for Global Fund, that women and girls, in all their diversity, they bring a unique perspective. They have their own skills and their own experience, and they can contribute significantly to pandemic response and to the recovery efforts. So we really should, ensure a meaningful participation, contribution to foster gender equality, resilience, and sustainable development. So as the Women for Global Fund, a global movement that you are all part of, whether you are a flourish group, a national focal point, a partner. We are all here to advocate for gender equality and women's empowerment. And on behalf of the following women's networks that you are all representing, we are sharing our concerns about the conceptual zero draft of the proposed WHO convention that Brenda just presented. So here in the call to action, we would like to, address and recognize the urgent need of the pandemic treaty to strengthen this global preparedness for pandemics. And as a call to action, Women for Global Fund with its national focal points. So we highlighted this in yellow, so we can add the countries that you are representing. And if you agree, of course, to for this call to action, after we discuss it, we can add the country that you are representing, so we can create this global solidarity and mobilize women and young girls from all the region, so we can share this call to action. And we are presenting here actually the main request that we have regarding this pandemic treaty. And there are three main requests, which are to ensure gender responsive policies and strategies. So for us, the pandemic treaty should explicitly integrate gender responsive policies and strategies that address the specific needs and challenges that are faced by women and girls. These include, for example, safeguarding their sexual and reproductive health and rights, promoting equal access to healthcare, addressing gender-based violence and discrimination that were really exacerbated during pandemics. We are also calling for strengthening women's leadership and representations. So the pandemic treaty should, support and promote the leadership of women in the pandemic preparedness, response, and also recovery efforts. And this can be done through an equal representation of women in the decision-making bodies, like in task force or expert panels, but also in having governments and institutions like WHO, UNAIDS, and global funds supporting, the involvement of organizations led by women, and to include gender transformative actions. So we have some evidence, and we have learned from experience that a meaningful involvement of women and girls can shape social norms, and they can, create a community cohesion. So we have the capacity to bring this evidence and to prove that a meaningful participation at all levels, national, international, and regional level, can catalyze the impact of health messages and also improve the implementations of health programs. And finally, we think that the pandemic treaty should emphasize economic empowerment for women and girls, and recognizing the impact of the crisis and the pandemic on their livelihood, as it was the case for HIV, TB, malaria, and just recently COVID-19. So in addition to this, previous request and recommendation, we think that the pandemic treaty should also acknowledge and address recurring human rights violations that occurs during pandemics, and it also should recognize women's rights that are, at risk in these circumstances, and it should integrate international standards on the derogation and limitations of these rights. Also, we talked about the issue of transparency and inclusivity for civil society and women's organizations, mainly women-led organizations in the pandemic treaty. And we are requesting some concrete requirements that need to be, seen in the pandemic treaty, like the access to information. So the information is key, and we need to guarantee that we have access to timely and accurate information that is shared with all the women-led organizations and civil society organizations and community networks. So the governments that are part of the negotiation should provide updates, data, reports related to pandemic preparedness and response. Second thing is the participation in decision making. So as Women for Global Fund, with all its partners and national focal points and Flourish Group, we call for a meaningful participation of these women-led organizations in the development, implementation, and evaluation of the policies and programs that will be related to the pandemic treaty. And it has to be through a clear procedure, like participating in advisory committees, in working groups and consultations. And we also call on governments to include women in the national delegations for the negotiation process for the pandemic treaty. Third thing is about resource allocation. So we call for, a dedicated resource to support the meaningful engagement of women-led organizations in the pandemic response and recovery activities. So we need to, give technical assistance to build the capacity of these women-led organizations, and also community network, and particularly adolescents, girls and young women, so that they can actively participate in the pandemic treaty processes. So like we said before, we call on government, but also organizations like WHO, UNAIDS and Global Fund to invest in strengthening opportunities and building capacities for women participations as, citizens, users, health workers, etc., so that they have an active participation. And finally, our fourth request is to add some principles that are non-discrimination and diversity in the pandemic treaty, and to ensure the inclusion of these women-led organizations and women in all their diversity, from civil society organizations to, to be part of the process, and to eliminate the gender stereotypes and harmful social norms. So these are the main requests that we put in the pandemic treaty. Of course, if you think that we should add other key points, we invite you to suggest that. We would like to have your feedback regarding this pandemic, this call to action. And to summarize, so Women for Global Fund calls all the governments and all the related stakeholders that are shaping this WHO pandemic prevention to integrate the gender transformative action, and also to consider that we have to fight stigma and discrimination, and to tackle gender inequalities. So, of course, together we can work towards this a treaty that will uphold gender equality and amplifies women's voice and leadership. And we have to make sure that no one is left behind. And especially, women and young girls that are in low-income countries and who have limited financial resources, with countries with, fragile healthcare system. So thank you all, and I look forward to receiving your feedback regarding this draft.
Thank you so much, Aliyah. That was really a very, very wonderful call to action presentation. Without wasting any time further, we would definitely be going back to, I'm so sorry, just give me, okay. So we would definitely be going back to, the roadmap. So Aliyah has given us the keynote message to stakeholders, which is basically the call to action to stakeholders. But before we go to campaign strategy, agreements, commitments, and final remarks, we would love to yield the floor open to everybody who is willing to, who has questions to ask. Yeah, so I'll stop sharing my screen so that I'm able to see the hands of those that are up right now. But I saw Eudora's hand up, so maybe we start with you. Eudora, the floor is yours.
Eudora, go ahead. We hear you.
Hi, good afternoon. Good evening. Can anybody hear me?
Yes, we can hear you.
I am so sorry. I was running around trying to unmute myself, but I didn't have the power to. Aliyah, thank you so much for the beautiful presentation. It's really a beautiful thing. But I have some few comments. Okay, so I'm going to talk about some call of actions. I think at this point we need to be imputing it in whatever we are doing. Now, you ask yourself, you will talk about pandemic. What is really a pandemic? Like sometimes we look at pandemic on the other side of having like a disease or something that will come about. There are some policies that are also pandemic. Now look at this anti-gender movement. Look at what is currently happening in Ghana, and I think Pakistan was affected, and some other West Africa or other African countries where they are currently passing law prohibiting law criminalizing homosexuality. So it is also a pandemic. I mean, we can't ignore that particular anti-gender movement is a pandemic. So I think we need to be also void to speak, because we have women and girls who are also LGBTIQ persons, and we have people who cannot even speak for themselves because of they have already been criminalized and their sexuality is something they are battling. So I think it's time we should also put in our voice. Uganda just signed their bill yesterday, and it's something that we look at and we think it's not affecting us, but it's a global thing, because from one country, another country is going to learn from other countries. Then I think they learned from Nigeria and they are going on doing what they want to do. So I think it is time we start speaking up about these issues and also realize that it's a pandemic. Even if we don't think it is a pandemic and it's going to affect everyone. Thank you.
Thank you so much, Eudora, for making such a very salient point. Like it's loud enough. Pandemics are not just diseases, but also policies are also pandemics, because in one way or the other, they impinge on global health response and preparedness. And I cannot agree any less with you. I would love to yield the floor to Maureen, after that Valerie, after that Linda, after that Princess and Nitel. So Maureen, over to you. Thank you.
Thank you, Brenda. I hope you. Okay, so mine is just one or two things. I want to thank you and your team for that presentation, for elaborating on what you have been up to, and also the roadmap that has been presented. But my question is, first of all, I've not had anything to do with funding. You've not talked about any opportunity for funding. So how exactly are we going to, implement this roadmap? And then you continue talking about sustainable development. I realize even the objectives, I think sustainable development goals were clearly highlighted as one of our agenda. But what exactly, when it comes to implementation of the SDGs, what exactly are we looking at? What targets? And also, if you look at a mandate that is given from the Office of the Secretary General of the UN, you realize that first of all, one of the things we need to do is promote the sustainable development goals. So what actual plan is it that we are doing? Are we only integrating, are we only, are we continuing to do integration, or are we going to look at separate or maybe independent activities that directly talk about SDGs, that directly communicate with the SDGs? So my questions are to one, funding. I didn't hear anything to do with funding, and then the sustainable development goals. Thank you, and over to you.
Thank you so much for that question. I'd love to pass this on to Angela to give a response. Or do we just take the questions now? But let me just pass it on to Angela to give a response, and I could add a few to what you have to say. Thank you.
Let's just like have all the questions and then we go.
Oh, okay, Angela. So over to you, Valerie. But thank you, Maureen, for that. That is duly noted. Your very first concern was around funding. how do we implement without funding? Really, that was really very salient. And the second is on the way forward with SDGs. So is it going to be the same old, modus operandi, or do we have separate activities moving forward to integrate? Over to you, Valerie.
Hello everyone, thank you so much. My name is Valerie Nasieku from Kenya. I have two quite simple questions. How can young people from the grassroots level, that is probably the lowest level in creating impact, be more involved and actively involved in pushing the agenda by the Women for Global Fund? I have also seen in the chat box, someone has mentioned that they're the focal point person from Zambia. I would like to know, as a focal point person, what do they do? And also if we have a focal point person from Kenya who is representing the Women for Global Fund, which will enable us localize what the Women for Global Fund is pushing for.
Thank you so much, Valerie, for that. That is really very salient. The involvement of grassroots in pushing the Women for Global Fund agenda, and also if there's a NFP, National Focal Point for Kenya, we would definitely get back to you on that. I'm actually taking note of your questions, so I'm sorry if you see me, I'm just taking note of every question. I'd love to yield the floor to Linda. Linda, over to you.
Thank you so much. I'm Linda Piri from Malawi. You've talked about the transparency, like access to information. So I was thinking that in some countries like Malawi and other countries, there are few people that knows about Women for Global Fund. And then there are some girls or young women-led organization that have that interest of making sure that almost everyone in the country has that information about Women for Global Fund and pandemic treatment preparedness. So I was asked, my question is how, what are you going to do to make sure that all these young girls or all these young women-led organizations that are at the grassroots level are included, or to make sure that these young women-led organizations are able to spread the information about Women for Global Fund, and also the issue that we're talking about here about pandemic preparedness? Because I've seen that one of the problem that is that these women-led organization faces is that of funding. For example, if a girl maybe has just started her organization, but then that organization is at the very low level, maybe she doesn't have some funding to implement the activities concerning pandemic preparedness and maybe about Women for Global Fund. So how are you going to deal with that? Thank you.
Thank you so much for those, nuggets as well as questions. They're really very salient. I cannot agree any less with you on setbacks with funding, and also the stringent donor requirements and challenges that comes with assessing funding as a newbie organization, especially at the grassroots level. There is the challenge of donor language. There is a challenge of language itself. There is a challenge of access to information around the funding. There is a challenge also of meeting donor requirements. And I love the fact that you're able to state this, and also, just lay more emphasis on the need to spread more information on what the Women for Global Fund is doing. We would definitely get back to you on your concerns. Meanwhile, I'd love to hear from Princess. Hi, Princess. You can actually unmute yourself. Would love to hear from you.
Hello. Can you hear me, please?
Yes, yes.
Can you hear me, Brenda?
Yes, I can hear you very well.
Okay, thank you so much for such inclusive platform. But personally, I'm just also having two questions I would like to understand. And personally, I'm looking at the current pandemic that is happening in Uganda, and since our Excellency, the President of Uganda, signed the anti-homosexuality bill, and my worry is about what is the way forward on how we can support grassroots transgender women, grassroots transgender or grassroots LGBTQ women who are in Uganda in terms of this street, especially for this period. And my last question is about how has been LGBT issues or LGBTQI women issues being addressed in this street? Because I haven't looked at it, because I feel the pandemic is beyond diseases, Maria, and all. So I would love to hear that. Thank you.
Thank you, Princess. Again, very salient points. There is the huge problem of the gender transient when it comes to treaties of this magnitude. We get to realize that the problem of inclusivity has really been the case because gender in all its diversity is really not being included, and a lot is not being accounted for. And that is why you get to see that Women for Global Fund is really very loud. And again, we would not agree any less with you, as Eudora said before. Pandemics really doesn't only mean diseases. It goes beyond that. And we could see, as the case is for Uganda and other countries, when it comes to policies that are cruel against LGBTQI persons and the trans community as well. So we would definitely get back to you on that. Meanwhile, Adiba, we would love to hear from you. Adiba, can you hear me, please? You could go ahead and unmute yourself.
Hey, hello everyone. This is Adiba Amin from Pakistan. I am student of gender studies, and also I am working with rural community women. Is in Pakistan, we can say we are a developing country, and majority of the world developing countries are patriarchal, and they are facing patriarchy, and the gender equality index is very low here. So my question is basically how the Women for Global Fund, when we are talking about Women for Global Fund, it means that we are talking about globally. We are we are talking to all the women across the globe in this chapter. So I just want to know how we can connect the local organization or the youth-led organizations who are not registered, or those individuals who are working for women rights in their nation, in their regional level, how they can connect to the Women for Global Fund. Is there any direct approach we can go for it? And are there any programs which Women for Global Fund is introducing so that the agenda of Women for Global Fund can be implemented towards the whole world? The same agenda for all women. Thank you.
Thank you so much for that, Adiba. I'll go back to what Angela always says. She says the existence of different development actors doesn't make us competitors, but more of complementing the work that each and every one of us does. And that is the same thing you've been able to say. So that is really very powerful. The need of, more of a mobilization of grassroots organizations at national context and regional context to be able to push the Women for Global Fund agenda. And thank you for the amazing work you're doing in Pakistan, and we'll definitely get back to you on that. And we will be wrapping up with Ethel and Shakira, but let's hear from Ethel first. Ethel, the floor is yours.
Thank you.
Thank you for the opportunity for us to learn and also be on the same page. For me, I share the same comments with what some of my colleagues have said, mostly about lack of information to people on the grassroots. And that's been a very big challenge, because for Malawi, I'll just give example specifically for Malawi, because it's what I can relate to at the moment. The girls that are in a Flourish group are coming from women-led organizations that are at grassroots. And that also means that they fall in the category of organizations that are just starting now. So their reach is really the grassroots, but that also entails that their reach is not as big as other organizations. Yes, they're making efforts in order to reach bigger audiences. But maybe for me, I would be interested to learn if we can coordinate with other countries that are doing really well in reaching the grassroots. We would like to learn from them how they are able to reach a larger audience, despite having the barriers with information, with media, I would say social media coverage. So for me, that's what I want to also learn, how to move forward with the agenda, despite having the challenges that the different girls are expressing. Thank you.
Thank you so much, Ito, for, like I said, laying more emphasis on the challenges that grassroots faces. And we cannot agree any less on the barriers, especially when it comes to information. Access to information is a key challenge. When it comes to capacity, we get to realize that capacity at grassroots level will not be the same thing for global organizations. And also coverage and reach is also another thing, because at the same time, we look at followership and all of these different variants inclusive. We should definitely get back to you on that, but thank you for painting a better picture using Malawi as a case study. And we would love to hear lastly from Shakira. Shakira, over to you.
Yes, thank you so much. My name is Shakira from Uganda, and I don't think I have much to say different from what the previous people have said. I only just want to highlight that when dealing with pandemics, generally, being that the disease or the issue is a new thing, there's always fear and uncertainty of what is going to happen next, and really to appreciate that this is a great step, a great movement, and also maybe to question that we've seen treaties being signed, however, like our governments undermine, even when they were part of the process of the signing, they undermine what was signed or don't really agree, later on or much later change their minds or don't even follow the rules of the treaty that has been signed. We've seen a couple of such treaties. So I will just maybe in a way question, like, what are our steps into ensuring that once our voices are heard, which I'm sure they will be heard, what is next for us to make sure that our governments follow the set procedures or the set treaty once signed? I don't know if I make sense, but yeah. Thank you.
A lot of sense. Angela, please, Dr. Jacqueline has her hand raised. So what is going to happen is Dr. Jacqueline will give you a minute to ask your question, but thank you, Shakira. The question on accountability at the level of governments, that is really a very solid question. Over to you, Dr. Jacqueline, and then the floor would be given to Angela to answer the questions. Thank you so much.
Okay, thank you so much, Brenda. Jacqueline Tungombe from Practice for Girls and Women in Career Development, an NGO working to promote the rights of women and girls in Tanzania. So I would like to ask on the preparedness of the Global Fund on funding and making sure that they promote, they contribute more on investing for women and girls during crises like this one of COVID-19. We have seen during COVID-19, it has been difficult to reach women and girls, especially the marginalized one. So how are we looking forward to ensure that the Global Fund is working on preparing on how they can invest for women and girls protection during other crises? And we have heard from the World Health Organization, another pandemic is on its way. So how are we going to prepare on funding, making sure that this fund reach women and girls, and how are we prepared interventional to make sure that women and girls are really protected during this crisis? Yeah, thank you.
Thank you so much. And Angela, the floor is yours. Thank you.
Thanks, Brenda, and thanks to everyone for your important questions and comments. I am first of all really happy to hear all these important insights that you have brought to this discussion. All the comments that you have also said in the chat are really important. And first of all, let's talk about what does it mean to be in that diversity. And there's also of course this meaning of diversity of women, girls, young adolescents, disabled women that are also included, transgender women. I mean, that's the diversity, and we represent this diversity from different origins, culture, language, religions, beliefs. I mean, that's a diversity that we want to also show and portray, and that's why we are working on this situation. I took notes of some of the questions that you of the questions that you raised. I'm going to go just giving some ideas and examples. And first of all, of course, we know that there are this is the first question that are around the SDGs. And we are afraid also that this can be the same modus operandi, and that we are not all going to, that we're going to repeat the same mistakes. And that's why we are calling on you and national focal points, florist groups, women networks, civil society, to just bring all these lessons that we have learned from the HIV, TB, and malaria pandemics and epidemics, because they are considered as one. So we can put out this information, and we can portray and see and show how this experience we already developed in the grassroots can really be useful for preventing the outcomes and outbreaks of future pandemics and the current ones. Because it's something really important to just note here is that we are not only advocating now in the pandemic treaty process for the future pandemics, but we are talking about the current pandemics, about the HIV, TB, and malaria. And it's really important to talk about this funding. And that's why we also advocate on the main important themes around the Global Fund, because Global Fund is still one of the main funders for the comprehensive response to these three diseases. And it's really important that they are also engaged in the process, and they also understand that the current pandemics are still ongoing, and there's plenty of things to do to reduce these inequalities. And just as you already mentioned, how can we really shape things from the grassroots level? How can we advocate from the grassroots level if we are not receiving information, if we are not included, if we are not feeling that we understand the process, or if there are still barriers to connect with the ministries of health, with the national, institutions, or with the other institutions? That's why we are now in this webinar, trying to spread the word regarding what's gender transformative advocacy, but also to share information with you. In this sense, we're going, I just reiterate the fact that we're going to send the information with you by email. That includes the presentation. And also, we are going to share the zero draft of this pandemic treaty process, in which you can see and read specifically what the governments are negotiating on, so you can have an idea of what is really going on this negotiation process. And how can we do things differently is let's use our power of mobilization. If we just spread the word, if we use our social media channels, if we can have if we can send documents, letters, key messages, make videos. That's how we can do those things from the grassroots level to advocate and reach this regional and global scene. And that's something we're going to talk about next in the communication strategy that we are planning also, so we can mobilize this together. But regarding also in the implementation phase and regarding fundings, there's we have in our web page, and I ask also Andrea that she can like put in the chat our web page and also the links where you can follow us on social media, and also you can join us an advocate in our networks. If you are already not included in our advocate list, you can join us. And also I'm really pleased to inform that we have now 10 national focal points in Tanzania, Zambia, Malawi, Nigeria, Kenya, Cameroon, Ghana, Botswana, Pakistan, and Uganda. And you can contact these countries. If you are from one of these countries, you can contact the women that are our national focal points. I'm going to write also their names, and they are also present in this meeting. So please feel free to just like contact them, so you can see how you can get also engaged in the activities, in the webinar sessions, in the training sessions that we organize as Women for Global Fund. And if your country is not, you know, like specified in the national focal point, you can also join as an advocate, and we can also send the information to you, so you can also participate in these campaigns, processes, and training that we organize as Women for Global Fund. And it's always up to us to just take this movement as far as we want it. As I always say, it's like, how can we are going to mobilize these things together? We learn from each other, and we receive like ideas, we receive suggestions and proposals on how can we all engage together in this grassroots level, community level, in which women are represented. And also important to let you know that we have 2 WhatsApp groups in which we share constantly information about the pandemic treaty, about different processes, webinars. And also these WhatsApp groups are the WhatsApp learning session groups in English. And we also have one for the French speaking people that can join us in this WhatsApp group. So you can all like understand what's going on there. We share information, opportunities for grants, or opportunities also for sharing like different perspectives. That's, I mean, how can we engage with Women for Global Fund? And I really encourage you to contact us, to contact Brenda and Alia if you have further questions for your countries, or if you want to join as an advocate. Just go to the webpage and then you can fill the information here. Regarding like the funding women-led organization and how important this is in the pandemic treaty process, in the call to action specifically, we're saying that there's a gap still on how this investment is not directed to the leadership of women, because there are still some social harmful norms, as you already mentioned, regarding, for example, the context in Uganda and how difficult it is for everyone to just like, you know, express human rights and guarantee these human rights. So that's why we are also included a key point in saying that we need to invest in quality interventions that are led by women organizations. This is something really important, as we know that mostly 70 or 80% of all the public health actions are conducted by women independently. And this is really important for communities and for women to sustain. And that's one of the key messages we're advocating. And then I ask you also to spread the word in the next campaign. Regarding like how can we really connect, for example, with the national like institutions, the Ministry of Health, and I think Alia just mentioned this in the call to action. The strategy that we as Women for Global Fund are advocating for is that we can be included in the national delegations for the negotiation process. And this can be achieved by, you know, by sending letters to the government, sending letters to the Ministry of Health, and stating why it is important for us as women to be included in this process, and acknowledging that if we are not included in this negotiation or dialogue processes, we're going to always fail on this idea of achieving gender equality. We can also think about like having a template in which we can send all to you, and you can use this template to adapt it to the context, to the different contexts on the countries. And you can use this template. So you can send a letter to the Ministry of Health or the Ministry of Foreign Affairs that includes some key points. And you can also like include and attach like the call to action, so they know why you are advocating, why are the reasons you are advocating for meaningful participation and inclusion. And with this, you can connect more with the Ministry of Health. Just like be sure to always like find the key contacts and also connect with other networks. So, like the more we are saying this as women networks, the more we're going to be heard. If we do it like probably in isolation, it will be complicated, but it's a really good idea for advocacy to just find partners, find other supporters that can sign those letters together and can be represented in the different national dialogues. So this is one of the strategies. And also regarding like how can we coordinate with other countries to reach larger audiences, I think that's also a key point. And I take this opportunity for us to interchange contacts. If you see someone from a country you're interested, and that you can find that there's like lessons learned or really good like approaches that they have put in place. This is the space in which we can share all this information. This is the space in which we are safe to just like advocate and indicate how we want to learn from each other. So I really ask the national focal points and also the Flourish Groups members, so you can communicate with other countries and interchange between all of you. So we give this a space, Women for Global Fund, for interchange, knowledge sharing. And this is the main key thing that we want. And that's why I also encourage you to join us in our WhatsApp groups or in our newsletter if you want to receive information from constant training and information that we share. And the final question, I think there was like two about like, we talk about funding and how can we really need to advocate, but something I really want to highlight is that when we talk about funding, we talk about like numbers and how and quantity, but something really important that we need to also think about is quality interventions and how these funds are really used in the field and in the grassroots levels and for women organizations. And that's a key role we have. And I encourage you also to please go to our webpage and consult on what does it mean community-led monitoring. We have developed an important tool for community-led monitoring that is how we can really be engaged and monitoring and evaluating that the activities around the pandemic process, around the Ministry of Health and Global Fund are really implemented on place. So if you have not heard about community-led monitoring yet, I really encourage you also to go to the webpage that we have, and then you will see information we have around this topic. And also please feel free to reach us if you have any other questions regarding community-led monitoring. I'm sure here there are plenty of people knowing this topic and experience, and also like amazing to see that you can interchange between all of us, and count on Women for Global Fund to be this space of interchange and knowledge sharing. And finally, this accountability, how can, this is part of the accountability that we want also to work together with you. And there's also, what's called the gender assessments, and the Women for Global Fund has had like a lot of experience like working on gender assessments. And I also ask you to go to the webpage. Probably also Andrea can help us like just sending the links, like briefly the links where you can find this information, and we can share it by email. We have already your contacts. And this is important because these gender assessments allow us to understand what are the needs specifically for the country, and women of the diversity, what are the critical gaps still to be addressed. And with that information, with evidence-based information, then we can work together on technical briefs, technical notes, strategic documents that can really be used to be sent to the national authorities or the CCMs, for example, in the Global Fund, so they understand what's going on, and that we as women advocates from organizations and civil society and communities, we do have the expertise, we do have the information, and that's why we are asking for some things. And this includes specifically indicators, key indicators, and also a request of funds. So I will stop there because probably I have took so many minutes, but I hope I have answered all your questions. And if there are like, I think we still have some more minutes. Please just like let us know if there is something more that we can talk about now. Over to you, Brenda.
Thank you so much, Angela. We really cannot thank all of you for taking out time, to be here. It's in meetings like this that we get to drink from each and everyone's well of experience. And it's a call to going back to our drawing boards. You've helped us, go back to our drawing boards right now. We are definitely open to more, like comments from you if you have none. What is going to happen is we would definitely be reaching you via email after the webinar on how we could collaborate moving forward. But thank you so much for making our time to be here. And I see two hands up, Ebere and Muni. So Ebere, I'd love to hear from you. The floor is yours. Hi, Ebere. Okay, while we wait for Ebere, Muni, you could take over. I can see you've already unmuted yourself.
Hi everyone, Muni here from Pakistan. I just want to add something like if I talk about women, we need our art is to like empower women through education, providing them education facilities and being sensitive towards their health problems. If I talk about here in my country, women's empowerment has been always been a hot topic in developing nations like Pakistan become to be occupied culture and social environment all over. Major indicators of human development of like women have been considering lower rather than men. No doubt Pakistan has taken some significant steps towards improving women, but their situation is still the same, particular in if I talk about in rural regions. Like in rural areas like say in Balochistan and social like South Punjab, there is still need to empower women to give them a space, escalate about their health issues. The relationship between economic growth and female empowerment is interrelated. Increasing women access to health, education, empowerment, employment opportunities, as well as their rights to political engagement can be like fruitful in order to reduce gender equality. Economic development can make a big contribution. So providing job opportunities is the main thing. Secondly, women are playing their role through entrepreneurship through the use of social media. Like if we talk about COVID, we have seen women utilizing their online platforms and conducting live sessions to introduce their brains. So technology also plays a role in women empowerment. Thank you so much.
Thank you so much for that, Muni. I mean, those were really very salient points passed across, and women empowerment is really very key. And like you said, it cuts across different spectrums, from education to, skills to life skills and a whole lot of other aspects. Thank you for that. I would love to hear from Ibera, and that will be us calling it a day from here after Ibera. Ibera, you could actually unmute yourself and talk to us, please.
Okay, good evening, everyone.
Good evening.
My name is Sebere Umegune from Nigeria. Thank you very much for the wonderful opportunity for this webinar. We really enjoyed it, and as well, we learned a lot from it. So I want to talk on a call to action regarding pandemic treachery, the inclusion of women-led organizations to eliminate gender stereotype and fighting stigma and discrimination, and inequality, gender inequality. So I want to begin, I want to ask from Nigeria, what Women for Global Fund, what are the strategies that is put in place to enable us really, since we are talking of treachery, pandemic treachery. What actually is the system in place for us to really fight gender inequality, stigma, and discrimination? Because talking from the community perspective in Nigeria, women are the most vulnerable, most especially women living with HIV. Like in Nigeria, to talk about HIV in Nigeria, without being stigmatized in so many communities, most especially remote areas, is really challenging. So what strategies do we put in place that is to tackle this stigma and discrimination, gender-based violence, most especially in this era of pandemic, in this era of pandemic? So what actually do we do? When we talk of strengthening policies and laws that is supporting human rights in Nigeria, like in HIV, we have anti-stigma and discrimination law. But it's quite unfortunate that some states in Nigeria has not adopted the law. Really, the law is available in Nigeria, but implementing the law is an issue. And the law is, how do we, for us to make sure that everybody in Nigeria are aware of this law, and even the law, that this law, as it protects people living with HIV and protects other women out there in our country, Nigeria. So what are the system put in place for we to achieve all these things? If this pandemic treachery, we are going to achieve it. So how do we go on with this in Nigeria and a community perspective? Thank you very much. Sorry, I'm on transit and there are lots of noise here. I'm so sorry about that.
Okay, thank you so much. Because of time, we would definitely get back to you, Ibera, but everything you have said is, very, very crucial. We go back to inclusivity, the call for action, the advocacy we are doing at different levels. And this takes us to the campaign strategy. I think what Ibera just spoke, is basically extremely key on the campaign strategy. So as we are wrapping up, it's very important for us to look into, like the campaign strategy. Would love to hear from you, basically, on strategies we could employ moving forward. And after which, we should definitely be reaching you by email for those of you who are open to collaborating and being a part of our network. So yes, we would love to hear from you.
Can you hear me?
Yes, I can.
Thanks, Brenda. So, as we have for some more minutes, I would just ask you, encourage you, we are going to develop some, communication tools. We're going to spread the word by the call to action. We are going to also, if you have comments more that you want us to include in the call to action, we have taken notes of all your comments, ideas, and suggestions regarding the different needs that women are, expressing in this important meeting. And then afterwards, we are going to share with you the call to action, so you can sign this call to action as individuals and also as organizations. And if afterwards, as I say, this campaign of mobilization and also advocating needs all of your support. So the commitments that we are going to probably agree on today is how we are going to spread the word together. And as also one of the colleagues mentioned before, let's use the technologies that we currently have. By internet, let's use the WhatsApp groups to spread the word, that tweet and retweets, all the social media campaign that we can spread, and use our networks to raise our voices. I think there's also a comment now from Eudora saying yes, that we can have like this promoting this interchanges among different women, and we can do that, of course. And there will be spaces in which we're going to invite you also to share country-specific information, or also all the topics that we are going to discuss in the next webinars, and we are going to invite you also to participate. So let's only be in touch. I think it's really important for us to get this compromise of how we are going to shape this call to action. So Alia will be the person, updating and also including all the information that we have from you today. And afterwards, we're going to send you the call to action so you can sign it. As I said again, as individuals or organizations. And afterward, it's up to us to share, to spread it in our social media, with our networks, by email, in our newsletters, so this call to action really reach many people, and that they can see that we are all together in this advocacy process. Also, I want to encourage you, if you want, like, for example, to produce yourselves like some key messages, and if you want us to retweet or to put those things in our social media, just like be sure that we can do those things. So if you have key messages, if you want to share, for example, stories on Instagram, and if you produce those things yourself, just like, you can tag us on the Instagram account that is Women for Global Fund, that I think Andrea has shared with you, like, the details. And if you have not yet followed us, you can tag there us, and we can, share again those among our networks. And that's how we are going to also spread the word and stories of impact on how important it is to engage women in the diversity in this sense. So we're going to use the power of technologies. We're going to use the power of knowledge sharing, and count on us to have this space as Women for Global Fund for interchange, knowledge sharing, and also the information that you might need to know is going to be available on our webpage, and we're going to send the links, so you can also get to know more about, we are talking about pandemic process and why this is related to the Global Fund. So I think that's it from my side. Brenda, over to you.
Thank you so much, Angela. I want to say a very big thank you to the Women for Global Fund team, and a very, very big thank you to national focal points and flourish groups from all 10 countries, as well as all of you from different networks who took out time to be here. This was a very robust and insightful session of us just co-creating, co-sharing knowledge, and going back to our drawing board. So we should definitely be in touch with you via email when we are done with the call to action to get your inputs, and also share links on how you could be part of the Women for Global Fund Global Network. Thank you so much for taking out time to be here, and looking forward to connecting in the days ahead via email. And we will be calling it a day now. This is the end of the meeting. And thank you so much. Have a great rest of your evening, afternoon, or morning, depending on where you're calling in from. And thank you once. Bye, everybody.
Bye.
Bye.
Bye-bye.
Bye. Bye from Cameroon.
Bye from
Bye-bye
Nigeria.
from